After ptosis surgery, how long is a reasonable period of time for swelling to reduce enough to start seeing any success? I'm concerned that my swelling is preventing any success from the operation. It would appear my eyelid is puffy and swollen directly between the eyelashes and the cut. Would this prevent the eyelid from retracting any further due to the weight of the swelling? It seems like the eyelid has now returned to the same point as before the operation, and I'm fearful there is more to this problem. My vision is blurred and is very sensitive to light. Would that be due to the eyelid not working correctly?
Thank you for your question. You are asking your question is what is adequate time for swelling to be a contributing factor in terms of postoperative ptosis surgery as it relates to the eyelid position, and you're concerned about the level of your eyelid as well as some blurred vision and light sensitivity after undergoing ptosis surgery, and you're concerned that you haven't had any improvement, and certainly it's a very common concern after this type of surgery. Of course, in the absence of more detail about the surgery and physical exam, I can share with you my experience as a specialist. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Ptosis surgery has been a very big part of my practice, and I have certainly a lot of experience with primary and revision ptosis surgery. And I'll review with you a little bit, most likely were principles that were probably discussed with you with your surgeon. Now, assuming you had this procedure done by an oculoplastic or oculofacial plastic and reconstructive surgeon, I'm certainly sure that you had someone who did this with great skill and knowledge and competence. But it is important to understand some guiding principles when we do ptosis surgery and what the challenges are to get predictable outcomes. Unfortunately, the eyelid muscle, the muscle called the levator muscle, like the word elevator, is a muscle that is affected and is the reason for the approach to most ptosis surgeries. And essentially, this muscle is graded as relatively weak or moderately strong or very strong. Essentially, we have our own technical terms, but basically that's how we grade the muscle. And then we look at the level of the eyelid, whether it's mild ptosis, moderate, or severe ptosis. Now, that being said, the surgery itself very, very often, and I think is the situation in your case, is either an advancement of that muscle or a shortening of that muscle so that the eyelid can be pulled upward. Now, if the eyelid is relatively weak, then swelling can push that eyelid downward because the muscle isn't that strong to pull the eyelid up. Now, to try to maximize the predictability of this type of surgery, we typically do this surgery under local anesthesia, essentially mostly with the patient awake. We may give a little sedation for the local anesthetic so that they're a little more comfortable during that point, but afterwards we'll actually have the patient open their eyes during surgery. We'll actually sit them up and look at them to see how they look, and we try to do it quickly because swelling can quickly impact the performance of the muscle and the level of the eyelid. So in terms of swelling after eyelid surgery, and in particular ptosis surgery, you're looking at several months before the swelling has resolved adequately to impact and have an effect on the eyelid. A lot of times we just have to allow time to go by because this swelling between the eyelid crease and the margin can linger. Now, certainly there can be some evidence of improvement early on in the first few weeks, such that little subtleties can certainly change over the course of time. But I'm sure that this is a discussion you had with your doctor. As far as the light sensitivity and blurred vision, you should speak to your doctor about this. And the reason why I'm saying that is that even though you may not have currently the optimal appearance that you were hoping for. If that muscle was shortened, then it's possible that your eyelid isn't closing fully when you sleep. And if that's the case, then you may be dealing with some irritation or exposure. There are other possible causes, but that requires a proper examination by your doctor to see if there is any issue with the cornea. The cornea is a clear part of the eye, and if it gets dry or if it gets scratched, you can have these symptoms. So it's very important that you see your doctor about these symptoms sooner rather than later, and not delay any more than is necessary. So discuss your concerns with your doctor. No one more than your doctor understands your situation preoperatively and intraoperatively. And so they can probably give you the best understanding of what happened, what transpired during surgery. And if you have recollection of having being asked to open and close your eyes during surgery, well, then that's also certainly helpful. If you had the surgery under a different circumstance where you're deeply sedated or under general anesthesia, well, then that's probably not relevant. But certainly discuss these concerns with your doctor. I always tell my patients that with ptosis surgery, no matter how much experience and how much we are able to try to get this ideal result during surgery, there's always a possibility of some overcorrection, undercorrection, requiring revision. So you have to certainly, I'm sure you've had that discussion as well with your doctor. So I hope that was helpful. I wish you the best of luck, and thank you for your question.